A recent study by American veterinarians found that 53% of dogs and 72% of cats are considered overweight or obese, and that puts them at risk for diabetes.
Come on, Maggie.
3-year-old Maggie has been a part of Charlie Allen's family since she was a puppy. So when he noticed that she was losing weight and had no energy, he knew something was wrong.
Maggie's a Labrador Retriever, and she developed diabetes about 6 months ago.
We brought her into the hospital and they asked if I wanted to run some extra tests just to make sure, rule a few things out. And they ran them and they started to figure out that she was diabetic. I didn't know dogs could be diabetic.
Some owners know that there's something not right with their pet. They have to refill the water bowl more often. If the urine dries a little bit, they'll notice that the urine is very sticky on the floor where the pet has had an accident. You might also see a pet who's losing weight despite eating very well.
Since her diagnosis, Maggie has been through a lot, including frequent trips to the emergency room.
She has sort of episodes where we'll be walking her and she will lose energy and stop moving and she looks disoriented. And so we carry glucose gel to inject into her mouth and put on her gums, and that brings her back most of the time. The other thing we had was she actually had a very big seizure a couple of weeks ago. My wife was with her and it was very hard for my wife because you're looking at your dog thinking my dog is dying.
After some close calls, Maggie now receives insulin shots twice a day. With her diabetes under control, Maggie is back to her old self.
In our case, a typical day is you get up in the morning, we test her first thing in the morning when we wake up to see what her blood sugar level is. We feed her and then walk her to work where test her urine on the way to work. If she's very high, we'll give her shot and start the day that way. It's a lot to manage, but it's just, we wouldn't consider not having her. It just wasn't one of the options.